Hello, everyone. Dr. Mandell here with you. Hope you're having a pleasant day or night. Welcome. We are streaming live and notifications are going out to our chat room now. I want to discuss a very important topic, one of the most important modalities when it comes to rehabilitation, when it comes to repairing chronic disc ailments, herniations, bulging disc, degenerative joint disease, as well as postural problems, forward head posture, pronated shoulders. Realize that a lot of our time is done in this position, taking our phone, looking down at it, texting, writing. We've gone through that over and over in our videos, but today I want to share things about massage therapy. In all the years I've been in practice and all the thousands of patients I've seen, I will never be without a massage therapist in our office. Not only did we have one, we had two, sometimes three, because of the fact that just treating a patient, just if it's chiropractic, if it's medicine, with ignoring the soft tissue, you're never going to get that patient well. When I say never, the odds are lower that you're going to get them well. The reason is, when injuries happen, when chronic stress happens, when poor posture happens, we develop what we call adhesions. And those adhesions is scar tissue. Remember, there's been damage. The body does not repair muscles, tendons, ligaments with normal collagen tissue that you had prior to an injury. It replaces it with fibrous tissue. Fibrous tissue is thick. Fibrous tissue is strong, but fibrous tissue does not have the durability and elasticity like normal collagen tissue has. So therefore, if you have muscles and the function of a muscle is to connect into a bone, if you look on each side of a muscle, if you just look above and below, those are tendons, and that attaches on one side or the other side. So if a muscle contracts, it's going to pull that tendon closer to it, moving the joint, moving the bone. For example, when I lift my arm like this, my deltoid is shortening, tugging on the bone so I can lift my arm. But when you have adhesions, these adhesions are like sticky glue, and these adhesions limit mobility. That's why after people have injuries, they have difficulty turning their head, bending their back, picking up their arm. Whatever joint is involved, it's not so much always the joint. It's more the muscle. It's the elongation, the stretching, the durability due to normal collagen tissue. But when scar tissue is there, it sticks. It's like gluey substance. So I want to go into some important things, the benefits of massage. But because this video is derived towards pain, I just want to say to you that if you are suffering with chronic neck problems and back, and I know I have several hundred thousands of people who listen to these videos, they have these conditions because those are the kind of people I attract. I highly recommend Myofascial Release. Getting in there, breaking the fascia down around the muscle, in the muscle, within the tissues to restore mobility. You'll be amazed how the body will respond. They say the worst thing to do for a shoulder or a frozen shoulder is nothing. Because the longer you leave a shoulder down without putting mobility into it, the more adhesions are going to start to occur. And that goes on with adhesions occur everywhere in the body. In the stomach adhesions, in the intestine adhesions. Adhesions are sticky glue that limits the proper function and mobility of the joint or the muscle that we're talking about. So myofascial release, trigger point therapy, proprioceptive neuromuscular facilitation, PNF, a form of neuromuscular reeducation. These things will help elongate the muscle, help restore function. Very important. I have seen hundreds and hundreds and hundreds of people get well through massage therapy when these techniques are applied correctly. Okay, so what I'm going to do, very simple, is I just want to go over some benefits of massage. I'm not going to go through all these, but a few important things I want you to understand. When you're in pain, you're under stress. When you're under stress, you have anxiety. When you have anxiety, you're tense, you have adrenaline, you have difficulty sleeping, you're nervous, you're shaken up. Massage therapy. Realize there's many kinds of massages. There's effleurage, which is gentle. There's petrissage, which is deep, more kneading. There's tapotment. There's all different kinds of massage, sweetest massage. But when it comes to therapeutic massage, we're going to make changes. We're going to do either cross fiber massage. If you see the fibers run like this, cross fiber. If you start cross fibering those fibers, you're going to get quicker results. Cross fiber massage is very effective. So it lowers anxiety, helps you sleep better. It gets congestion out of the cells. Remember that those are cells. They need oxygen. They need nutrition. They need the proper nutritional substances for those muscles to work properly. So if you have an injury, you have congestion. And as you have congestion, that lactic acid gets built up along with other toxins, and you have spasm, you have pain, you have shortening of the muscle. Massage therapy can do wonders for you. Listen, I'm not a massage therapist, but I'm telling you, it will help you. I have the knowledge. I have the years of experience. I've seen it over and over and over. I've had patients who've been like this and torticollis. I've had conditions that you just won't believe, fixations, adhesions, frozen shoulders, just hip contractures. And it's amazing that when you start putting the body through mobility, what it can do. Chronic pain, it will reduce chronic pain. It will loosen those tightened muscles. It will help you with posture, because if you're doing postural exercises and you have adhesions, you need to get rid of those adhesions. You'll be much more productive. Okay? So I really don't want to spend much more time on this. I just wanted to make that point to you. I hope that this flies. You understand this. I promise you. You get treated by a good, educated massage therapist that puts their heart, puts their love with their hands together on your body. You will really see great miracles. And why am I telling you this? Because we can't leave it out. I think that if we leave things out like this, we're going to be looking for problems, chronic problems, and that's why a lot of these conditions do not get well. So even if you have herniated discs, I don't care. Most of these conditions are not coming from your herniated discs. They're coming from adhesions. Take it from what it's worth. I really hope that this helps you. Share this video. Check me out, Motivational Doc, on Facebook, as well as leave your messages here below. Most important, make it a great day, and we'll catch you on our next video. Bye-bye now.